Good morning, everyone. Buenos dias, and welcome to the Hispanic Institute's 31st dialogue. My health depends on your health. Mi salud depende de tu salud. The Hispanic American Institute has once again assembled a group of experts and stakeholders to discuss another timely and important topic, especially as it pertains to the Latino community and businesses in New England gateway cities. This Zoom, as all the other ones, are available as Jen Olson will record this and make it available. Alberto Calvo will send it out if you want, if you need to forward it. Again, we have a great panel who will be discussing the following topics. We want to clarify the need for the booster shots, who qualifies, why it's needed, and so forth, all of the questions around the booster shots. We'll also provide an update on the whole process for the vaccination of our children. That is a hot topic that folks, especially given the news this week from the governor's office, it's been all over the news, very timely, and always very interested in an update on who is still resisting and why. We have two guests and two panelists who work right in the, I would say, heart of this issue. One from East Boston Neighborhood Health Center, another one from Mass General Hospital. So we'll get to the panel in a second. But before we begin, a word from our fearless leaders, Nader Acevedo and Alberto Calvo. Buenos días, Nader. ¿Cómo estás, Alberto?
Very good. Thank you.
Gracias, Alberto Vasallo. My name is Nader Acevedo. I'm the Executive Vice President of the Hispanic American Institute. And we have the offices we have one in Puerto Rico, one in New Mexico, and Alberto Calvo and myself. We work here in Boston and we try to manage the office. Alberto, why don't you tell us a little bit about what we are doing in terms of the grants and...
Sure, yeah. Welcome everybody. Bienvenidos a todos. Como dice how Nader says, we've been working in various issues, economic issues, health issues affecting the Latino communities and in Massachusetts, New England. And this Zoom meeting is one of, I think we're number 31. We started these when the pandemic hit, particularly for business owners that were looking for financial help that was offered by the federal government. So, and then one led to the other. Alberto Vasallo has helped us a lot in putting these together for topics that are of relevance at the time. And naturally, booster shots and this pandemic, la pandemia, how they saw it, we call it in Spanish, has been here far too long, and we need to get this in our rear window, and vaccination is the key, and particularly now that we're in the hopefully the final stretch. We have this program that David Crowley is leading to see if we can go that the last mile to get this pandemic behind us. So thank you and welcome everybody.
Excellent. Thank you, Alberto. Thank you, Nader. Hey, Jen, I'm going to ask if we can go to the slides that we have provided just to give us the little overview of what we're going to be talking about today, because there is an important kind of theme here of mi salud depende de tu salud. That is the name of today's program. It's the second one. And I just want to take a moment to kind of give an overview before I present our speakers. So Jen, if we have that first slide of the campaign with the campaign name. By the way, happy Veterans Day for everybody who's online. Muy felicidades a todos nuestros veteranos en el día de hoy. Again, mi salud depende de tu salud. This is the next phase of the COVID-19 vaccine awareness campaign. We have several partners in this. Obviously, you see the CSI, Social Capital logo. They are one of the three major partners in this campaign. The next slide. And what it is information directed to Latinos designed to provide information directed to parents regarding child vaccination process. So spotlight diverse voices from the community via that slogan, "My health depends on yours." That's the English translation, but it really, it has more power in Spanish. And explain how vaccine works and why it is important. Thanks to the Hispanic American Institute, Social Capital Inc., and you'll see the campaign on the El Mundo Boston platforms. Next slide, Jen. As David will tell you later on, there are many ways you can participate by being ambassador of the Social Capital Inc. campaign, which he's going to talk about, but we'd also love to have your face lent to this campaign. Those folks you see there are common folks. We will see them all around. We will be in the next month showcasing members of our community with that little cross heart. That's kind of going to become the symbol, the heart. And if you look at the little logo in blue, Mi salud depende de tu salud, you'll see folks with that symbol, that messaging. I think we got one more slide. And like I said, it's just different folks. Those are the kind of the social media and print ads. So yes, once David explains how his ambassadorship works, we will also use David to recruit folks for this. So if you can lend your face to this campaign, it will be mostly appreciated, because the more people can kind of spread this out. And the idea is pretty much everybody who comes out with this, they'll spread it to all of their friends. And we want it to be a united collective message. All right. And having said that, let's get right into our panel. I'm going to start with El Doctor Efren Flores, the Massachusetts General Hospital. He serves currently as a thoracic radiologist at Mass General Hospital, but he also serves as associate chair for MGB's Radiology, Equity, Inclusion, and Community Health. He is also an assistant professor in radiology at Harvard Medical School. He's current scholar in diagnostics excellence from the National Academy of Medicine. And I found most interesting is his research and his research efforts focusing on access to care among underserved patient populations has been published in peer-reviewed journals and have led him to participate in local and national committees. Buenos días, doctor. ¿Cómo estás? Hope all is well. Vamos a escuchar de usted en un ratico, right?
Buenos días, and gracias. Thank you for having me today.
Excellent. And I also hear your all-time favorite athlete is Roberto Clemente, of course. I imagine you're Puerto Rican.
That is correct.
Easy deduction. Dr. Thomas Silva is my next panelist. He's been board certified in pediatrics since 1993. He's also at East Boston Neighborhood Health Center since 95 and started the CATCH program, which is Children's Access to Coordinated Healthcare. It's a primary care program for children with developmental disabilities and severe health problems. He's been an active member of the National Disaster Medical Team and the Massachusetts Division, which has had him been deployed to 25 major natural disasters. He's been medical director of pediatrics at East Boston Neighborhood Health Center since 2014, where he continues to have an active panel of primary care patients. And his all-time favorite athlete is Bobby Orr. So hi, Dr. Silva. How are you? ¿Cómo estás?
Bien, buenos días.
Buenos días. How is your Spanish from 1 to 10?
4.
Cuatro. That usually means 6 or 7 because everybody always gives himself a lower. If you probably speak it and understand it more than you give yourself credit. We will get back to our nuestro amigo Dr. Silva en un momentico. And our third panelist, which will kind of round off today, President and founder of SCI Social Capital Inc., David Crowley. SCI's mission is to strengthen communities by connecting diverse individuals and organizations through civic engagement. It provides communities with skills and tools to engage citizens to make a difference with a priority on promoting youth success and healthy community. David brings 15 years of leadership in the nonprofit sector. He is, again, the founder and president. He's a graduate of Harvard University, but way more important than that, he is a graduate of Woburn High School, which makes him class of 87, which makes he can relate to my 80s post. Hi, David. How are you?
Good morning. Yeah, you're dating us both with that one.
That's okay. Hey, understanding 80s stuff is pretty cool in my book. So you're my kind of peeps. Yeah. Bueno, Vamos a comenzar. Let's start with that overarching question with our two esteemed doctors. Let's get right to the kind of the first talking point, which is the booster. Everyone's talking about the booster shot. In full transparency, I went to East Boston Neighborhood Health Center and got my booster shots. But can we go over who qualifies? Because I'm not over 65, so, and I do qualify. So can we go over that, Dr. Flores, if you could start us off?
Sure. So there are a few indications that for people that can get the booster. One, those are that have medical conditions after age 55, or that have medical conditions that put them at risk or to be immunocompromised. And also now the booster shots have been approved for those that are working high risk situation or healthcare settings. So for example, I work at the hospital, so I became eligible to get a booster shot, which I did. When was it? 2 weeks ago, I got my booster shot as well. And Dr. Silva, I don't know if you wanted to add something to the eligibility criteria as well.
Well, there's a group of occupations that probably were not listed at the beginning of the pandemic that qualify people for boosters, including food and agricultural workers, people who work in food production, grocery store workers, public transit workers, postal workers, corrections workers, and then also people who live in congregate settings like group homes, so that qualify immediately for the boosters.
Also, because I'm not 65, I'm not an essential worker, and I don't have any medical conditions. Those who took this Johnson & Johnson, right? So that's why I was able to go to East Boston Neighborhood Health Center, right, Dr. Silva?
Yes.
Johnson & Johnson, folks. So again, a lot of people still asking a lot of questions on why. Why do we need a booster shot? In the case of others who already took the 2 doses, why this third dose? In my case, Johnson & Johnson. What's the major thrust behind getting this, and why is it needed?
I think the most important thing is just to your point. I really like the campaign that for example, with the slide that you're showing right now, right? In terms of like, mi salud depende de tu salud, like my health depends on your health, right? So it's definitely a joint effort. And what the booster does is just give your immune system like an extra shot. So, for those who like coffee, right? So we're like half day and maybe need to finish the day strong. We may have an espresso shot or like a midday coffee to do that. And the same thing for the booster. What it does is just gets your immune system, but it's already primed from the original vaccination schedule to get an additional dose in lower level than the original vaccine, but just to get your system it serves like a reminder that about the possible threat, to get your immune system ready in case you encounter somebody that may be infected with COVID infection, and also you can still potentially get the COVID, get infected by COVID, but then your system is more able to fight this disease and prevent a serious illness that may end up in the hospital or like in the intensive care unit.
Yeah.
I think it's
Dr.
difficult
Silva,
for us. Oh, sorry.
Yeah, no, I was going to kind of ask you, because when I was over at your place, East Boston Neighborhood Health Center, which, by the way, the service was great, English and Spanish, great workers over there, very, very friendly. They also explained that, you don't have to necessarily get the same, the booster can be different than your original vaccine. So could you explain a little bit about that kind of cocktail or mix of shots?
Well, I think it's difficult for us to imagine what our immune system does inside our bodies. It's easy for us to imagine what our bones are doing or what our hearts are doing or what our lungs are doing. And the immune system, parts of the immune system exist all around the body, and it just sits there waiting to fight something that is that's trying to get into our body and make us sick. And vaccines and natural infections stimulate the immune system to do the same thing. And Some groups of infections don't change over time. The measles virus is the same now in 2021 as it was in the year 1800, probably. So the measles vaccine actually produces long-lasting immunity. And if you get 2 doses when you're a kid, you're protected pretty much for your whole life. The coronavirus infection is really a group of infections with lots of different kinds of viruses that that make up the same problem that we're trying to prevent. And each of the vaccine companies produce a vaccine that pretends to be the virus in a slightly different way. So you get an infection or you get a vaccine for something, and your immune system prepares to fight that the next time it enters your body. We need boosters sometimes because our immune system might be able to remember or might not be able to remember a particular kind of thing that's threatening us. And the reason why booster vaccines from different companies work is because even though the technology might be technically different, the things that they do in our body are fairly similar. You know, two cars from different companies are different cars, but they're still cars.
Mhm. And again, this is free. It's basically the same process as before, right? Call up, as I did, East Boston Neighborhood Health Center. It's free, and you go there, and they don't ask any questions about, you know, where you work, you know, your status here or anything. It's basically the same easy process as the original vaccine, right?
Yes, and in our specific case, you can make an appointment by calling or with a link on our website. I would also say that it's much easier to get a vaccine now than it was a year or 9 months ago. And most people's usual sources of healthcare will have vaccine available. You know, most private pediatric offices in the state will be offering this vaccine where they didn't 9 or 10 months ago. Many of the barriers for ordering the vaccines and distributing the vaccines and storing the vaccines have been eliminated or at least modified.
Excellent.
And to that point, I just wanted to briefly add to Dr. Silva's point that not only it's more accessible within the healthcare institution, but also we have to think about there's a lot of community campaigns that are putting vaccination centers in the community, and also local pharmacies are part of these vaccination efforts too. So to that point, there's a multi-pronged approach to getting accessible appointments, and so when we say which vaccine or what booster, always say like the next one available is your best shot at getting through this.
Yeah, and again, to the 2 doctors, I was also given a booster card, you know, proof of the vaccination. I've been getting asked a couple of events now for proof of vaccination and booster. Should we all still take a picture of that in case we don't have it on us, and have it on us at all times, almost like your driver's license, or at least on your phone or somewhere? Just is that something in our society that we're going to still have to live with for the next, at least foreseeable near future?
I have a picture on my phone, and I actually do not know where my original card is, unfortunately.
Okay. But
So
same here. I have a picture. I do have my card, but then also now there are a lot of apps that basically you can upload your card and it creates a QR code that is scannable as well. So like later, like at the beginning of December, I'm attending a conference, and they require for you to register with a photo of the card, and then you get back a QR code that states that you've been vaccinated in order to gain entrance. So it's a good practice to keep that handy, or at least take a photo so you know where it is. And it's for the foreseeable future, I think that will be just to be on the safe side, that we keep that available and safe.
Although I would say that this whole system relies much more on trust than on proof. I mean, you do have to show proof to do certain things, and there's a different level of proof that's required for different activities. International travel, air flights, restaurants, going to the Celtics or Bruins game. We are asked to show some documentation, but it's not like fingerprinting or retinal scans.
Yeah, or playing quarterback for the Green Bay Packers. I had to throw that in
We
there.
gotta, no, but we gotta, and the trust part, and what Dr. Silva mentioned is actually very important, right? In terms of like somewhat like an honor code, but more, and that's why it's so important that we have in mind campaign like this one, right? So in terms of like protecting each other, keeping everybody healthy is everyone's responsibility, right? So your health is my health, and that's key, right? And then also building trust in the system, but in each other, and that there's no secondary gain or harm associated to this. The main focus of everyone in today's discussion is to really keep health at the center of everyone's attention and the discussion, and then everything else will come, like getting over the pandemic, getting together, like all the other parts will start falling into place as long as we all contribute to this cause.
Yeah, but I mean,
And
back
I'm-
to your title, I wish we didn't have to fight about this anymore every day. It's just not necessary. We're just trying to help each other through this.
Yep. And to round off the discussion on booster before we move on to the vaccination for children, quick question for either doctor. Is the booster shot for Pfizer, does that last for 1 year? Is there differences between the booster shots?
I don't think that there's enough information to judge how long the booster effect will work. We've only been dealing with the pandemic for 2 years, so most of our answers to these questions are educated predictions.
Excellent. Okay, let's move on to the second point, which is let's talk a little bit about the vaccination process for children. Up until now, all of these vaccines were for adults, I believe 18 and over, right, doctores? Now that's expanding. How do you see the process for children, and how has now that become safe for children? What's kind of the clinical, your clinical explanation when people ask you about the vaccination for children? Is it safe?
The simple answer is yes. A slightly more complicated answer is that it was relatively easy to prove that the vaccine was safe and effective for adolescents, because most adolescents' immune systems function the same way as adults' immune systems. So in terms of the tetanus vaccine, measles, flu shots, I mean, what works in a 60-year-old in other vaccines has really always been proved to work in a 10 or 11-year-old. So that age group was specifically studied in a second group for vaccines in the experiments that showed the vaccines were effective. Younger children's immune systems respond differently to vaccines than adults' vaccines. So the vaccine safety and usefulness in that age group had to be studied independently. And that happened over the course of the last 6 or 7 months, which is a relatively brief period of time in many people's minds, but it's actually a long enough period of time to determine whether a vaccine is safe or effective, because where vaccines have been shown to cause side effects, vaccine side effects appear within a month of receiving a vaccine. This vaccine specifically was studied in nearly 5,000 children aged 5 to 11, over the past 10 months or so. And there were 2 things that were proven in the study. One was that children's immune system between 5 and 11 functioned equally well as children's immune system 12 to 18 in laboratory studies of response to the vaccine. And also that the children in the study who got the real vaccine compared to the artificial vaccine had far fewer infections. The children who got the actual vaccine had far fewer infections almost immediately than children who got what's called the placebo. And that's enough children in general to know if something works and if something's safe.
Yeah, No question.
You know?
Dr. Flores, you guys over at MGB and MGH have this I think it's called We Care or Cares MGB program that Dr. Betancourt started, and really got a lot of information from you guys, the doctors who are working from our community, the Latino community. Obviously, Dr. Silver's main population is Latino over at East Boston Neighborhood Health Center, but regarding children and the vaccination, were Latino parents more or less or the same worried about getting their children vaccinated during?
Absolutely, there's a increase. There is a concern, and more so because a lot of the information that is available about vaccination in general, and particularly on all patient population, but specifically now about pediatric, it tends to be available in, for example, primarily in English, and then other languages not as available. So Spanish information is not as quickly, although right now we're doing a lot of effort to have both English and Spanish available at the same time. And the reason for that is because when we have a lag in dissemination of accurate information, right, trustworthy information from trusted resources, then when there's a lag, then gaps are created, and then that's where misinformation sits in. So then what happened originally when we're doing the initial vaccine campaign, there was a lot of not only talking about the benefits of the vaccine and the safety, but also we're addressing a lot of misinformation that was shared through social media and other methods in the community. So now lessons learned in our pediatric efforts have been more proactive in the approach of just been talking about both in English and Spanish, and addressing the concern of the Latino community to have that information available. But as a parent, I have 4 kids. I have 1 teenager, and then the other ones are under the age that I just became eligible, 1 11, then twins that are 8. And my teenage son, I got him vaccinated as soon as possible. And even in his school, there was a lot of chat among his friends about like, why should they get vaccinated and everything. And then we have to have a conversation about with him in terms of like our benefit, what we're seeing in the hospital setting. And then my 3 younger daughters have an appointment tomorrow to get their vaccine because now they became eligible. So, we didn't think from the healthcare system standpoint, from us at Mass General Hospital, and in the same way, Dr. Silva from East Boston Neighborhood, patients trust us when they have other medical conditions, and I can assure you that we do everything for our patients and with their best interests at the center. And the COVID pandemic and the vaccine and everything that we talked about, the precautions and testing, is no different. It's just that it's something that is newer that we're all tackling together. And we wouldn't be promoting or even having this conversation today. We didn't think that this was something safe. I wouldn't get the COVID vaccine or the booster myself if I didn't think it was safe, nor I would put my kids through the vaccination effort if I didn't think it was safe. So in order for us to really come out on the other side of the pandemic and really get us together, and particularly now when the holidays are coming, we're thinking about Thanksgiving down the line, Christmas, New Year. This is like really all like a lot of time where families come together, they travel, and all. There's a lot of Latino food coming through. It's really it gives us an opportunity. We have an opportunity to take control of our health and either get vaccinated for ourselves, get the booster, or for our children to better protect them about this illness, because we will do everything to keep them safe, and this is part of that.
Dr. Silva, you deal with a lot of kids. How do you is this a learning opportunity, a teaching moment as well when we bring our children to get vaccinated?
I think a lot of families have heard and have had personal experience that the infection, it does not seem as severe in adolescents and children as in our uncles and aunts and grandparents and parents, and so people feel maybe less fear or less urgency to get the vaccine for their kids. On the other hand, there have been more than 8,000 children admitted to the hospital with serious coronavirus infections. And in just the group between 5 and 11, there have been almost 200 children who've sadly died from the infection. And the question is, how many, which children should we protect? How do we convince parents? It's difficult for parents to sort of accept those numbers unless, unfortunately, one of those 200 children. I try to be very gentle and inviting when I discuss this with parents because numbers don't convince people. I have a background in science, so I can understand science and numbers. They really speak to me. But the same things that I would use to convince myself are not necessarily convincing to families or adolescents. Also, if you give an adolescent a chance to choose whether they want to get a vaccine or not, they're gonna choose no.
And I think that it's a good segue for our third little kind of update on who is still resisting vaccination and why. I know that we have this great campaign, which is the second one, right? Which My Health Depends on Yours, which is a little different take, right? Don't do it for yourself. If you think that nothing will happen to you, think about others, family, coworkers, etc. So who is still resisting and why?
People who are confused and people don't know what to think. We have been bombarded for a year with coronavirus news. It's unavoidable. And if you look at this website or watch this channel, it says one thing. If you watch another channel, it says another thing. And we're just plain mystified. So some of us are just confused. And then, unfortunately, it has become one of the key areas that we can choose to disagree with each other. And I just wish it wasn't, because it's not, like I said before, it's not necessary to make this the difference that we're going to argue about on Thanksgiving and Christmas with our cousins and neighbors and relatives.
I agree with that. I think that they unfortunately become very divisive topic when it shouldn't, right? So when a public health issue requires cross-sector collaboration to tackle together, right? That's very well exemplified by the group coming together here this morning, right? So we're coming from different sectors coming together to talk about the particular issue that is present. But one of the few times, or probably the only time, that I've seen where a public health issue have become something Dr. Silva mentioned, something for debate. When the science is coming clear, what we're seeing in the front lines is clear in terms of like the people, definitely the proportion of people that are getting admitted with severe disease from COVID are those that do not have a vaccination or have not completed the course of vaccination. And we see it every day. I work in the thoracic radiology when I'm on call, or I'm seeing, like, with all the chest x-rays of the people that have been admitted with COVID to the hospital. A majority of those patients are either unvaccinated or only have one shot. They didn't complete their full section. If it's the vaccine that requires two, if it's Johnson & Johnson, which require one, then sure. But those are the vaccines that when people, and to me, it's heartbreaking to see that many of these patients that were admitted to the hospital, you see in their chart that they had a scheduled vaccine appointment 1 month later or 2 weeks later, right? So just timing. So it goes back to what Dr. Silva was mentioning earlier in terms of like, it's so important when you have the opportunity, and now that it is widely available, take the opportunity to not only take control of your health and during the pandemic, but also do it for your loved ones in your community, which is the more altruistic approach from this campaign.
I think that that now leads us to what we can do collectively. I think, as Dr. Silva was saying, we're all going to be talking about it, still talking about it during Thanksgiving and Christmas and the holidays. It's still a topic that's all over the news. Again, whether it's athletes that don't want to be vaccinated and employers, what do you do with employees who don't want to get vaccinated? That was a question for the governor as well a couple of weeks ago. It's still an ongoing thing. What can we do to help this campaign? And from here, I want to go to David Crowley, the president and founder of SCI Social Capital Inc. David, first tell us a little bit, very briefly, about your organization, and then kind of how folks can get involved.
Sure. Thank you, Alberto. And it's great to hear from the doctors really breaking down this important information this morning. Sort of the premise of our organization, Social Capital, really long before the pandemic, is that ultimately when we live in neighborhoods and communities, we are in this together. If we are working together in a community to, make our schools stronger, make our streets safer, we're all going to be better off. And, that has probably never been more true than in the past 18 months. So our organization was able to get some funding from the CDC to put together an initiative in collaboration with partners here, the Hispanic American Institute and El Mundo, to sort of focus on some communities that unfortunately have been very hard hit by the pandemic, including communities like Chelsea and Lynn and Lawrence, as well as different Boston neighborhoods, to say, how do we build on this idea that, while people might not be able to trust, what they see on TV or the internet, the people we trust the most are people we care about, people that, they might be, cut our hair, or they might be our family members at Thanksgiving, to really try to leverage that is the idea of our program. It's called the Vaccine Equity and Access Program, or VEAP for short. And so our goal is to basically put together a team of ambassadors, as we're calling them, who will be working with us and working with our partners to, get trained up and get enough information. They're not going to have as much information as the doctors on the call, but enough information to answer some of those common questions that might come up, whether it's at the Thanksgiving table or on the sidelines at a soccer game, to be able to say, hey, this, explain, that the fact that boosters are out do not show that, explain why that doesn't show that the vaccine doesn't work. It's just that extra boost, like that extra the second cup of coffee, the simple explanations. So the idea is we will be training folks on those concepts. And so people can sign up to be an ambassador. It's a very low lift. If people sign up, Charlie, I think if he hasn't already, we'll put a link to sign up. We send out a weekly email update about, some frequently asked questions, some of the latest news in plain English and Spanish is the idea, so that people can get a steady stream of information. And because we are funded by the CDC, we do have access to a lot of the latest information and talking points to try to fill that space, so that I think if there's a void, the misinformation will unfortunately win the day. So we need to counter that with, the fact-based information coming from people we trust. So that's our goal. And the other piece I will mention is we also, to be an ambassador, it's very simple. It's a light lift. There are some extra things you can do. As Alberto said, we're looking for people to put their faces to the campaign is one thing. We also have a leadership position that has a stipend associated with it. And that's for people who want to maybe dig a little deeper with us and, get a little more involved, maybe put together some kind of small campaign in your own neighborhood, or maybe if you have kids in school, maybe you want to do a presentation at a parent meeting or something like that. So, and we would help you and support you to do that. So we are looking for people, as I said, we want to get a big team of ambassadors, and then sort of, I guess you could sort of, we were talking sports a lot, so sort of an all-star team, if you will, of people who want to be leaders in this initiative and work with us a little more closely on our goals.
Excellent. Tell us more about this ambassador program, because I know that you were trying to sign up folks. What does that entail? Can the doctors be part of this too? I know that I'm signing up. We have others. what's really required and how do you be, what is an ambassador for this campaign?
Yeah, so the ambassador, it's very simple. As I said, you just sign up, and the commitment is to say, hey, you're gonna try, in your day-to-day life to integrate, where it makes sense, not to not to try to beat people over the head with, hey, you should get vaccinated. But when conversations start coming up to say, hey, you want to be someone who's going to feel comfortable. That's one of our goals, is to give people enough information that they feel comfortable, without going to medical school, to at least have enough knowledge to have some simple conversations with folks as they go about their day-to-day lives. So that ambassador goal, it's to some extent is just publicly raising your hand saying, yeah, I want to be part of the team that buys into the my health depends on your health concept. The leadership role is a little more involved, but even that is not super heavy lift. We ask, that's a commitment of coming to an initial training and then 2 follow-up meetings where we'd be going a little deeper on, some, practicing, maybe some role playing, how to talk through common questions that people have about the vaccine, and then to also do some kind of planning, like thinking strategically about who do I influence and come in touch with. Maybe it's Alberto Calva, who his family owns a few grocery stores. There's things that can be done as a small business owner, incorporating, some incentives for customers, who maybe they got 5% off their turkey if they show their vaccine card. So part of the idea is kind of working individually with leaders who sign up and sort of want to, basically, the leaders would be responsible for coming up with their own game plan, if you will, as to how I can really influence folks in my network, again, without dropping my full-time job or dropping what I'm doing as a parent, but to kind of integrate it into what I'm doing day to day, and work with SCI and our partners on kind of our own little strategy or game plan for how we're going to try to get those numbers up there a bit, because we talked about in the last call. I hope it's gone up a bit, but I think the vaccine rates in the Latino communities is lagging behind some of the other communities, and unfortunately that makes the community more vulnerable to more bad outcomes. So we want to level those numbers off and need folks to step up to help us with that.
Excellent. Well, it is now 9:44. We're going to try to end a little bit early today, only because there's a couple of reasons. First, I think we've all noticed in this world, everybody's attention span when it comes to social media and videos is getting shorter and shorter and shorter. And one of the lessons I've learned over the last 5 months is, even with social media and digital media, is less is more. And people want quicker information in less time. So we're going to try to give folks back, let's say 10 minutes. And maybe we could finish at 9:50. Want to appreciate Dr. Efrain Flores from Massachusetts General Hospital. Obviously, muchas gracias, doctor, y saludos a nuestro gran amigo, Dr. Betancourt, Joseph Betancourt. If you happen to see him, tell him greetings from us. Dr. Thomas Silva, obviously, I'm a fan of East Boston Neighborhood Health Center. I got my shots there, both the first one and the second one, which was yesterday, the booster shot. So say hi to Steve Snyder and everybody over there as well, Michelle Haggerty and so forth. And David, muchas gracias. We'll still be working for the coming months on this campaign, getting some of your ambassadors to participate in some of the ads. Jen, if you could leave us with a lasting image of maybe that slideshow of some of the ads of, and that image of My Health Depends on You por mi salud, tu salud. Mi salud depende de tu salud. Yep, that and some of the images of the folks right before that, the last slide with the ads. So if once you see that logo, everybody, now you kind of know what it is. It's trying to also make it a catchphrase in the Latino community. And the little logo, just like we did with La Vacuna Salva Vidas. I think that this second approach of all our healths depend on each individual's health. So with that, any parting words from the doctors? I always like to get parting words from doctors.
It works. It's safe. Get it.
Yep.
And
I
then if you
promise.
have a question,
Less is more. Love it.
You wanted to say that there's no healthcare system. We're all trying to do what is best for you and your loved ones. And then there's no judgment. So please feel free to ask any questions to your trusted provider or anyone when we're in this setting. There's no judgment here. We're all here in the best interest to provide information to the community. Please feel free to reach out when you have any concerns, anything. There's no question that can't be asked. We're here to provide as much information and clarify any concern that you may have. What we say is no judgment zone. So we all want to get everyone vaccinated and really get us through the pandemic together.
Excellent. Excellent. David, any last words?
No, it's been a great program, and I hope some folks will stay connected to us and help spread this message.
Excellent. Alberto and Nader, you guys are going to finish this off so that we can go on with the rest of our Veterans Day. It's gotten off to a great start. Alberto, anything to add?
I'm in mute, sorry. This is an excellent presentation meeting. By the way, David, I signed up for the whole shebang, leadership and everything. So
Excellent.
But I've been thinking maybe we should do something like Amway or political campaign or something. But it's really I'm saddened by the fact that people do not see this as a must, but anyhow, I signed up and I'll try to do my 2 cents. And thank you for Dr. Flores, Dr. Silva. It was very, very illuminating. And we'll keep the emphasis on this and see if we can get out of the because I think the light is at the end of the tunnel, but the tunnel is becoming really long. So thank you, everybody.
Thank you. Thank you very much.
Nader, any last words?
Yeah, thank you very much to the 2 doctors and everyone that participated, Dr. Flores, Dr. Silva. Thank you very much. You make really good, you gave us many good answers that we didn't know before. So thank you very much. And David, thank you for putting this together, and Albertico, and everyone, have a good day.
Okay, have a good day, Maria Camila Padilla. You too. I will see you guys later in the office. Bye, Dr. Silver.
Thank you.
Gracias. Thank you so much.
Thank you, Camila.
Bye, doctor. Jorge Andrade is in the house. Carmen
Jorge
Zambrano.
Andrade.
Y Rodolfito. Un saludo a Rodolfito también ahí.
Hi, everybody. Have a great day, everybody. Great talk.
Jorge.
Alberto Calvo, I'll end up at the one in Lynn. I'll go.
What's up, people?
There you go. And Rodolfo.
Everybody's in the camera.
Alberto Vasallo, gracias por todo. Bye-bye.
Gracias, doctor.
Yeah.
Gracias a
Thank you,
todos
doctors.
ustedes. Have a great rest of your day. Take care.
Thank
Thank
you.
you, Albertico.
Bye.
Bye.